早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our Icon Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do learn acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. After a stroke, because the brain has been injured, so psychological issues may arise because a person cannot talk, cannot move, and is irritable. So because the area of where the stroke occurred also affects that person psychologically. And it not only causes physical problems, but it can also create issues in terms of mood and cognitive abilities. Today we have invited psychologist Dr. Tigerson Young to talk about how to rebuild oneself after a stroke psychologically. Dr. Young, if you have joined us in previous fora, you must have seen Dr. Young because Dr. Young is a very famous person. He works full-time as a psychologist in UBC, Kwantlen Polytechnic, and Thompson River. So every month he hosts a program on Chinese radio. Welcome, Dr. Young. Happy to see you again, and thank you for taking time again to talk about rebuilding oneself after a stroke. You have the mic now. How is everyone? Can you see me? Can you hear me? Perfect. So first, should I share my slides with you guys? Yes, if that is so, fine. Give me a moment so that I can share them with you. Thank you, ICON, for again inviting me, for giving me this opportunity to share with you. We have a fantastic topic today, and thank you for those who are joining us at home for this opportunity. Let me see if I can share the screen with you, the slides. If I can't do that, I will have to pass the ball back to Barbara's court. I can't move my slides. Well, anyway, we're going to talk for about 20 minutes. 20 minutes. Yeah, so we can talk about 3 different topics regarding rebuilding oneself. We can explore how a person himself or herself changes in terms of her identity. And then we can also explore psychological interventions for stroke survivors. And third, we can, from a psychological perspective, to explore how to prevent stroke. So if you have specific questions, okay, use the chat function and leave us a message or a question. See if we can respond to that afterwards, okay? Now, let's jump to the slide where it talks about identity changes after a stroke. Now, after a stroke, what kinds of changes are there in identity? So we have heard about a lot of information. We have a lot of information in terms of our physical functions. Now, actually, a stroke can also affect our mood and also our identity ability. So how do you identify yourself after a stroke? For example, maybe we use our profession to represent our identity. I'm an engineer, I am an interpreter, and I'm a professional athlete, all of that. So all of those. And you can also use other ways to identify yourself. Like, I'm a Canadian, I'm a half Indian, East Indian, or I'm a 100% Chinese. So you can use other ways to identify yourself. For example, I am Linda's husband, or I am Wei Zhong's cousin. So you can use many kinds of identities. So before a stroke, most of us has already had a certain identity of oneself. A lot of research has found that after a stroke, these identities actually there are many changes in those. Now, before, many people just took it for granted. And then all of a sudden, overnight, it changed. Now, in 2024, there was a research in the United Kingdom. So there were 14 women and 16 men who were interviewed, not a big research. So they talked about what happened after a stroke, the experiences after a stroke. This research found that after a stroke, actually there was a certain period of time in which they were ambiguous. Ambiguous meaning that this was what we call a liminality. So this was a very difficult period for a stroke survivor. And you can understand that, of course, because after a stroke, initially, at least, all of a sudden, all of these take for granted identities, all of these roles which one had taken for granted before, they changed drastically. So that was so unexpected. They caught us by surprise. It was a period of time where our identities all of a sudden changed so differently, so drastically different, so uncertain. So before, okay, we could do these things, many things, okay, we could still do them, but some we could not do. For example, if we're trying to speak a sentence, we express it so differently. So research found that this liminality, this ambiguous stage, has a decisive factor, is a decisive stage for the stroke survivor. No, I think there are many factors. For example,
before a stroke and after a stroke, and dealing with it, it also affect the recovery process after a stroke. One of the effects is you can often see, because the vulnerability in terms of life, there's a very deep appreciation. Perhaps before that you didn't think that life could be so vulnerable. All of a sudden, with the experience of a stroke, the perception of life may change very drastically, and a stroke patient may also have feel that self-insufficiency when they compare the identity of self before a stroke or compare with other people. They make us think that the self-insufficiency is stronger after a stroke. Self-identity rebuild may be more challenging. Also, maybe it's a more long-term process. The rehabilitation effect may be affected by different factors. In this research, it's found that you have to help stroke patients to arrange the aims and beliefs and social relationship, and also the dialogue in life. When you rearrange after self-identity after a stroke compared to before a stroke, maybe after a stroke, maybe you need to rely on other people to help with a lot of some items in your life. I could do that before. I couldn't do that. Now I have to get help from other people. To the stroke patient, it may mean that I have lost some independent living ability, self-management ability. So to the stroke patient, and also this affirmation, the identity affirmation, maybe it will have a very serious effect. So it would make us feel that maybe we would feel helpless, a very defeated sense. So the stroke patient, maybe before a stroke and after a stroke, the self-identity and maybe there's a disconnect, so that you will have a crisis in identity. So this crisis may make us the life after stroke cause some hindrance. And okay, we'll look at the next one. The research also found that when the stroke patient is ignored or is on the fringe, the rehabilitation is getting more difficult, especially in the initial liminality. A lot of the stroke patients may ask, why me? Why it happened to me, right? So apart feeling is a very unfortunate thing. Sometimes they may think that, like we just mentioned, self-insufficiency, maybe I did something wrong. So maybe before I did something, we blame ourselves. This self-insufficiency make us all fringed, being on the fringe, being ignored. And this self-stigmatization will make more hindrance in terms of rehabilitation, becomes a vicious cycle. I forgot to tell you to bring the next one. Next one, please. So if the factors like these from the initial liminality becomes a long-term liminality, then the rehabilitation process and speed will be affected more severely, the stroke patient will be more and more. The self and reality will have more distance. The self-stigmatization would be more severe, making the stroke patient more isolated, like we have said, becomes a vicious cycle. Okay, next slide, please. How do we help stroke patient to rebuild their identity, reconfigure their value? We see whether we can focus on a few things. First, how to help some stroke patients to accept the present situation. Okay, what I can't change the past. I can't control the future, but what can I control the present? How to help the stroke patients with their need to pre-evaluate priorities. Thirdly, how to help stroke patients to rebuild meaning in life. What I could do in the past, now I can't. Sometimes my life meaning may be changed, especially maybe in the past, my occupation, I could do certain things, my identity, but now there's a change identity. I have to look for a new meaning. Fourth, use different dialogue to describe our identity, to describe the process of the disease. You don't have to blame yourself. It's my fault, I did something wrong. If we can change that dialogue, maybe that vicious cycle will not be so severe. So next one, please. Some of the factors will help the rehabilitation, and some factors will hinder the rehabilitation. The rehabilitation that's helpful is help the stroke patient, the relative, the friends support. If we can do self-centered care, more comprehensive, more holistic care to care for the patient in terms of all the different needs in different areas, maybe is very helpful. On the other hand, if the stroke patient has this stigmatization and also fragmented care, then it would also cause a lot of hindrance to the rehabilitation process. Next one. In other words, stroke patients, apart from having the physical function and the need when we care for them, if we can also add some additional support, maybe it'd be helpful. For instance, how to help them to rebuild their self, and how to help them long-term and more holistic care, and also how to listen to the stroke patient, their life stories, how they had this stroke. So perhaps in that case, it might be affect the quality of the rehabilitation. So next one, please. After a stroke, one of the more common resources that we saw, like this morning, we heard many exercise, physical therapists, speech therapists, occupational therapists, etc. So if you could adhere to the directions, of course, all this would be helpful. Next one. Apart from the physical function and rehabilitation, the psychological treatment of the stroke patient is very important. In 2023 report included 30 stroke patients. The stroke time from 1 second to 5. It found that the self-identity reconstruction for the rehabilitation has a very important role. Next one, please. So in terms of psychological treatment, in the process of doing that, we realize there are a few factors. Perhaps it may be to the stroke patient is cause some hindrance. First, a lot of the patients, they think they are judged by others. You are not done enough. It's not good. It doesn't mean that other people are really judging them, but this is a very common psychological reaction. So we have to remember when a stroke patient, when the friend has got this reaction, when they think like that, perhaps is like after a stroke, like maybe is some effect on the brain, is effect on the mood, and so that they have this reaction. So it's not uncommon. It's not odd. It's not uncommon. Some of the symptoms may not be obvious. So, for instance, a patient, in terms of the degree of the stroke, maybe is more minor, but the rehabilitation may be more ideal. But then there's still different from what they expected. So this may not be obvious to other people. For instance, using of their limbs and also the way they speak, the speed and the clarity. So this unclear symptom, sometimes it would bring about some misunderstanding. Other people might feel that maybe this is deliberate. There's no reason for you to not be able to do that. You could do other things. Why not do this? So maybe there's some conflict caused. Thirdly, in the process of rehabilitation, a lot of the patients feel very isolated. There's some disconnect with the outside world. It's a vicious cycle when you have a stroke. We feel resistant to the outside world. We don't want to go out. We don't want to talk to other people. We don't want to be seen by other people. The present physical situation. So when things like that happen, is again another vicious cycle. One gets more isolated and more distant from the outside world. Also, fourthly, the stroke patient may lose some meaningful role, our occupation, our identity, other history, etc. Fifthly, stroke patients, many times, they don't like to become one that is reliant on other people in life. When we feel like that, we feel that more vulnerable. We feel that it's like we are debased. So when it comes to taking care of stroke patient, if we can be more understanding of the difficulty of all these factors, then we may be able, taking care of stroke patients, we may be more effective. Next slide, please. When we have to take care of a stroke patient, we can try the following strategy and see if they work. First, we can try to encourage the patient and the family and the friends and other professional people to have more in-depth and all dialect. Sometimes we just say, we ask whether you have any function change. Sometimes other speakers say stroke doesn't affect our intelligence. Doesn't mean that when I have a stroke, my intelligence drops. So maybe we can have a more meaningful, more in-depth discussion, and not just say that, oh, what have you eaten, what have you done. And we can also try to encourage the stroke patient to reframe their story, to reinterpret their process, not that they have done something wrong or they did something different. If we can reframe this dialogue, it may be more helpful in terms of the process of rehabilitation. We can also help stroke patients to regain their agency. Even though after stroke, we may not be able to do a lot of stuff, doesn't mean that I can't do anything, right? So if we can help some stroke patient to find new agency, then we may be able to think that to make them not feel so helpless, so useless. So we can try to help the stroke patient to set new goals to regain agency. Fifthly, we can we have to learn how to listen to the stroke patients so that they will feel they're accepted, they are understood. It's not that I have to help them to solve problems, right? Just like sometimes the stroke patient, they just need us to accept them and listen to them, so we can use a different method. Next one, please.
So even though you don't need to care for someone who has had a stroke, but as a family member, there are many other things that you can still do. We can try to accept it. Okay, accept the moods of someone who has had a stroke, because sometimes they cannot control it. It's not like they do it on purpose. We can also try to respect and not be judgmental, to interact, to talk with someone who has had a stroke. We should also respect their abilities, their current, and not focus on their limitations. We can also encourage them to participate in the decision-making process, because they can still make decisions. So it's not like, oh, this person has had a stroke, not very fluent in speech and not very mobile. So we still have to give that person an opportunity to take part in the decision-making process. We can also use some way to talk about the future, the near future, not like 5 years from now, 10 years from now. We just want to talk about between now and the next few moments. We can try to focus on listening, not to rectify, not to correct their speech, their stories, okay? Sometimes we just have to listen. Next one. Now, in terms of psychological treatment, so one of the strategies we use is what we call a dyadic coping. Now, in this process, we can hope to encourage the person to participate more in social activities. So if you are a spouse of someone who has had a stroke, this is a very important role that you're going to have to play. So especially the ones that that person loves, you can encourage them to take part in social activities, and also through our intervention, we can hope to change or improve their technique when they communicate with their spouse or family members. And again, take a more active role in community activities. We can use different strategies. Speech is just one of the strategies, because communication is more than just speech. Non-speaking part, for example, facial expressions, gestures, drawings, graphics. So using these dyadic communicative skills, then they can learn new strategies. Next one, please. So in this dyadic intervention, it includes daily living skills, communication between the two people, how to manage their strategies, how the family play their role either indoors or in other activities, and gradually they can address the skills and how to deal with pressure, and then they can then expand that to outdoor activities. For sure, the ultimate objective is for the person who has had a stroke to come back to reintegrate into social life. So other than these psychological and interpersonal therapies, now we can also use other alternative treatments, for example, music therapy, to improve their moods. Now, moods can comprise depression, anxiety, and other symptoms. So what good does music therapy do? After a stroke, many patients, in addition to injuries physiologically, in terms of their mood, they have also suffered. Now, if a patient has anxiety or depressive symptoms, so it can affect at least 30 to 35% of the survivors. So music therapy is a non-intervention kind of therapy, or non-invasive kind of therapy. So music therapies can also coordinate with other therapies like Tai Chi or 打段锦 and other kinds of therapies. So, and then I know I only have 3 minutes left. So, other than therapies, of course, we want to prevent another stroke, because psychologically it's very important to have the right mindset to prevent stroke. So there's a research done which covered 48 studies, and actually here it says 57,000 patients, and the findings were that many times there were complications like depression and anxiety after a stroke. And the research also told us that early intervention, how important that plays a role for the patient. Now, from another perspective, mental health is also important. For example, it can be a protective measure. And in the next line, we skip this one. This is the last one, okay? Okay, let's be quick. Get to the last one. Exactly. Now, let me put it this way. So there are many research projects which find that there are very negative impact on a person's mindset. So, but being an optimist has positive effects. Now, for example, we're not certain from our research whether those who have had a stroke, what are the exact statistics, but depending on how you look at it. If you want me to bet on a roulette, so I will bet on the red part, the optimistic part, so that we can prevent these cardiovascular complications. Now, family members, what can family members do? Now, in the recovery process, as a friend, as a family member, you can try to praise them. Okay, praise them. Even a little bit of praise is still good. Okay. We also have to schedule an exercise program, but make sure that the place to do exercise is safe. We can ask the staff, what about those home exercise? How do you do them? And then you have to give yourself a treat after you've done one session of exercise so that you can make faster progress. So again, thank you, Icon, for again giving me this opportunity to share with you my information, and hope that 2026 brings a new year, a year of better health, especially for those who have had suffer from a stroke, and then they can recover more quickly and better. Thank you. Thank you, Dr. Young, for such detailed information and analysis on the psychological impact on the patient and on the family members, and what kind of tips you had given us for the patient to recover. Here we have the ways to contact us, Icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@ubc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.